Good afternoon, everyone. I'm Bert Eicholt, Health Officer of Mobile County. Pleased to be with you as this press conference is a unified command dealing with COVID-19. It's working with a good team of individuals trying to limit the spread of COVID-19. Everyone's working very, very hard, and thank you so much for the sacrifices you're making each and every day in order to prevent the spread of this deadly disease.
So other than the health aspect of what the Unified Command is dealing with from the city's perspective, we're fielding a lot of questions about how do we ease back into working again. So a lot of conversation about that with restaurateurs, with the close contact businesses. Later we'll be talking with the governor's office, and we'll hopefully find what the thoughts are on the pathway forward, although there's no obligation on her part to do anything until the 15th of May. But as information becomes available, we share it first, with one another, and then that comes out with the JIC, the Joint Information Command, as part of this. So we'll continue to have these meetings at least once a week, as long as the command is stood up. Thank you.
The Unified Command allows all 11 municipalities really to be on the same page about how we're going to handle our response to COVID-19. We didn't want a patchwork where you go from one municipality into another municipality to figure out what the rules are. We want one set of rules so that everyone will know that wherever they are in Mobile County, that this is what it takes to comply. And we're particularly pleased that so many people are using their masks when they're doing their retail shopping. They're going about, not everyone is doing it yet, but we are happy to see those who are. It protects you, and it also protects the people who are working in those essential stores where we can get those things we need, and we thank you for that.
Okay, so at this time we'd be glad to answer any questions which have been supplied, I think, previous to this meeting.
This question is for Commissioner Ludgood, Mayor Stimpson, and Dr. Eichel. If cases spike later in the year or any time in the future because there isn't a vaccine or a viable treatment, would you support a return to the significant restrictions on businesses, schools, and large gatherings? If so, would there be a particular threshold of cases in the hospital that would trigger this?
Well, there's certainly thresholds in hospitals that will trigger any decision, I think, that is made. As far as determining whether I would support, let's say, another stay-at-home order, it will depend on the information that's at hand. It's going to depend on, what the impact is on the health of the community before I would say commit to the fact that I would support that stay-at-home command in the future. Yep.
Yes, the health department is very excited about moving forward. We're going to have to make incremental steps as we reemerge, and as we've talked about before, I think it's very important that we watch and look at the data. It would have to be a significant change in a data pattern to sound the alarm, and I think we would all discuss the three principles, even if we're not under a unified command, and have conversations with the governor's office and with other areas. The interesting thing that may happen with this particular disease is one community may be real stable and not having any spread. Another community may have a significant increase in cases. And there are going to be days where there's going to be a case here or a case there, but if we see a pattern where the caseloads go up and then it doubles, and then several days later it doubles again, just like we got into the deep water, we'll have to have serious conversations, because the main way this virus, it invaded the United States of America and is taken the lives of 70,000 people, so I consider this a war, and we have to be very cautious of what the enemy does and how we respond in order to protect the community. So it would be a significant, change in the pattern of disease spread. But if we get a large number of community-acquired activities, obviously, and it seems to be associated in one cluster of certain types of behaviors in certain geographic areas, we will meet with wherever that particular area is and see if we can't eliminate or decrease that spread. I do not see another stay-at-home order unless we end up with a second wave as occurred, which was significant. It was worse than the first wave in 1918, and we're trying to avoid that with good education. So thank you.
I think we're going to have a good bit of data to which we can refer as we make these kind of decisions. And for me, if the data shows that staying at home, that shutting down, taking those kind of radical measures will curb the disease, if we see an outbreak and we see a second round of it, yes, I could support it.
For Mayor Stimson and Commissioner Ludgood, the ACLU in a statement on Tuesday said that while Mobile has taken steps to reduce its jail population, it is not enough to give that close confines of a jail can become vectors for COVID-19. According to the ACLU, Mobile still has one of the largest jail populations compared to its population size that surpasses the jail populations in Jefferson and Montgomery counties. Has enough been done to reduce the jail population in Mobile County?
Yes.
Okay. Given that testing is going on outside the jail, should the inmates also be a part of the testing in order to further the preventing the spread?
Timothy, I was getting ready to answer.
Has enough been done? Has enough been done?
Yes. Okay.
To reduce
the population. So in the population of the jail, there are kind of two categories of inmates, one of state inmates and one would be the municipal inmates. And we have reduced, I think, the jail population by maybe a couple of hundred possibly. I know at this point in time, we've reduced it by 500, someone just signaled me. But at this point in time, there are only 50 municipal inmates in the jail. And so from the city's perspective, we have done as much reduction as we possibly can. I think the remaining population of the jail and what can be done there, that would be a question for the sheriff, for the county. And when it comes to the next part was, there's two parts.
Given that testing is going on
yes, should we be
outside
testing the
jail,
inmates? Again, that's a question that should be answered by the sheriff and maybe by the county or the public health department. In this situation, the city, our role in this was simply standing up the testing facility. We put the tents up, we coordinated with South Alabama to be there. And so we're providing just that service. So we haven't decided, it was the sheriff that decided he wanted to test all of his employees. And so somebody else will make that decision, and not the city of Mobile.
When you talk about jail population, the issue becomes really complex just because of one of the things that the mayor mentioned, and that is because you have different categories of inmates in the jail. One of the things that has happened in this state is because of COVID-19, some inmates are in our jail who would have otherwise been transferred into the Alabama Department of Corrections, and that has not been able to happen for a variety of reasons, and so we have that contributing to it. When it comes down to the decisions about the testing in the jail and making those kind of decisions, those are decisions that the Sheriff of Mobile County, Sam Cochran, makes. It is the county jail, and the county does fund its operations, but the management of the jail is Sam Cochran's responsibility, Sheriff Cochran's responsibility. And as I understand, he's making his decisions in consultation with the Mobile County Health Department, which is certainly appropriate. So it is not an ideal situation in terms of the numbers, but given the complexities of where we are and the reality in which we're having to live because of COVID-19, I think we're doing what we can to keep as many people as safe as possible, the employees and the inmates in the jail.
Really, testing becomes a medical question. They have a medical provider under contract at the Metro Jail to provide health care for the persons who find themselves under conditions of confinement. We commend the sheriff, Mr. Wilhelm, Trey Oliver, Chief Barber, and the mayor for helping get it done. But the testing was actually done by the University of South Alabama. And what's interesting is that the majority of the testing in Birmingham and Jefferson County is being done by UAB, and the majority of the testing done in Mobile is being done by the University of South Alabama. So they're a great partner in doing testing in our community.
Mayor Stimson and Dr. Eichel, do we have any idea where our local hospitals are currently with regard to the availability of ventilators, hospital beds, and ICU space?
I will defer that to Dr. Cepeda instead of Dr. Eichel.
So we do know those numbers, and there's still available capacity for all the things that are measured in the system. The numbers, though, look different than they did last week because as of this week, all the hospitals in the area are performing non-emergent or elective surgeries. So we would completely expect those numbers to change, and they have, which is not a bad thing. So that's a good thing. The hospitals have typically, in the last 6 to 8 weeks, been operating at a very reduced capacity just to keep availability for an influx of patients if needed. For the surge in COVID patients. So because they had been able to keep that low, they were able to open up for elective cases this week. And I'm Laura Cepeda with the Mobile County Health Department. I'm the Chief Medical Officer. So the numbers, we have them. There's still capacity on every metric, but it does look different than it did last week, which is not a bad thing, I think, if you ask all the hospitals. They don't like operating at half capacity. Yeah.
Mayor Stinson, can you describe the process the city is using to reach out to businesses regarding the emergency grant program?
Yes. So we refer to that as Excite Mobile, and that's where, Ignite Mobile. Ignite Mobile, thank you for that. And we're actually doing it through social media and through the media. And so already today we've had people apply for the grants, and my understanding just prior to walking down here that a barber had gone online to fill out the paperwork. And we asked, how long did it take you to fill out the application? And he said, it took me about 5 minutes. He said, but I had my business license number and I had my certification number from the state. So it's very easy to do, and just through the social media outlets and through the media that we're getting the word out. But there's also a direct outreach from the Revenue Department to all of those businesses that we felt like were qualified. We have reached out to them through email, and if there's no email contact, then we're doing it through snail mail. Okay?
Several sheriffs have voiced their intentions of not enforcing the health order via making arrests. Does the city of Mobile share the same position?
No.
Are you planning on making any requests to the governor to amend her health order?
So That's an ongoing conversation. You know, I know the governor is reaching out to different individual mayors, and mayors are reaching out to her. We would like to see her open up the business for those close contact businesses and for restaurants, but we know that she has a timeline. We know that she's looking at data, and all we can do, you know, is give her the information that we have from our community, and we have been doing that.
How soon do you anticipate receiving funding for COVID-19 testing for homeless and senior residents of public housing? And is there a timeline for such testing?
So I know that we're teed up possibly for this Friday to start testing in Crichton Towers. And as far as the receiving of the money, that money is coming through, I think, through HUD and through the CDBG. And so I don't know exactly when we will receive that money, and it's possibly that we have. I just not sure that.
Should restaurants be reopened for dine-in, or are you concerned about spreading the virus to at those locations?
Well, I think everybody is worried about the dine-in, you know, and I think it hinges and how you think about it depends on how many people will be allowed in the restaurants. I don't hear anyone speaking of over a 50% capacity, you know, for any restaurant, and I don't even hear the restaurateurs asking for anything more than that at this point in time. And I think this should be concerned, you know, as we ease back into this to see what the impact is going to be. You may not know what that impact is for a couple of weeks after you open that up. And then there's a whole other series of questions. Is there testing that can be done, you know, to see if there are any of the employees shedding the virus, and how do you quarantine them? So, you know, it's going to be a step at a time, but I do think it's time to start making those steps now.
Now that retail is open, what's the next step in your eyes?
So I think it is with the close contact groups that Ignite Mobile and the restaurants. Those are the two areas that we hear the most about, at least from the city's perspective.
Thank you, Mayor Stimson.
Yep.
We now have questions in regards to the Health Department. Would Dr. Eichel and Dr. Sabeda please step forward? The current health order is set to expire on May the 15th in conjunction with the phase reopening May the 1st. Given the incubation period of COVID-19 is anywhere from 5 to 14 days, is the current expiration date too early to tell if we will see a spike in cases, and too early to lessen the restrictions even further?
It's really too soon to tell. The incubation period's anywhere from 2 to 14 days. The 3, 7, and 14-day averages for the state are actually continuing to increase. And, you know, according to the White House criteria, the gating criteria, they really wanted to see a 14-day decrease. So we have not met that criteria at all. So, you know, we'll continue to follow the numbers, but we're not looking like we're meeting those criteria. Still, you know, over a week left until we reach the end of this period that the governor has set. And we'll just continue to follow the numbers and see what they show.
Restaurants, barbershops, and salons are businesses that are mandated to have sanitation training. Given this fact, should they, with capacity restrictions, be allowed to reopen?
Well, that goes back, you know, really to the White House criteria, and that's what the governor and Scott Harris were following when they did that. So, you know, if we haven't met the criteria, just even for the phase 1 of that, I think that's why they said that they stopped from keeping those from opening. So.
What is your reaction to the Mobile City Council passing a resolution on yesterday urging all citizens to wear protective face coverings when entering or working in a place of business?
We definitely support that. In fact, Dr. Eichel had, you know, issued a similar order encouraging that a few weeks ago. I believe, I don't know the date, but definitely support that. Wearing a face covering helps protect you, but more so it protects others. One thing we're seeing more than was anticipated is the asymptomatic spread of this disease. And so, you know, on one hand, that could be good because we may be having higher cases and lower morbidity and mortality than expected. But on the other hand, it makes it much easier to transmit if you are completely asymptomatic and unaware that you could be spreading it. So, you know, protect yourself, protect the people around you, and wear a mask and good hand hygiene as well.
Mobile still leads the state for COVID-19 cases and deaths. There are calls to reopen restaurants for dining and service. Is that a bad call right now?
You know, again, it goes back to the governor and Dr. Harris following the guidelines set out by the White House for those, the gating criteria, and we haven't even met the gating criteria for full phase 1 opening. So I think that they're going to reevaluate at the end of this 2-week period and see where we stand there. And Mobile certainly is, you know, the hot spot in the state, so we are not anywhere near that 2-week declining numbers.
Nursing homes continue to bring a lot of cases to our area. What is being done to limit the spread?
So long-term care facilities and nursing homes started being very proactive about taking care of their residents very early into this. I think going back as early as March, they limited access to their facilities to only essential personnel and no visitors into the facilities. Infection prevention measures have been taken, and actually we have a team of infection control workers within the health department that is on daily calls with every single long-term care facility and assisted living and even senior living facility within the county daily to get a full report of how they're doing, full status report, if they need anything, how they are on PPE, to give them just help, you know, advice, what they can do, how they can help. If they have, even if they have or if they haven't had any cases, hopefully within their facility, whether that's healthcare workers or residents. They have, for the most part, all of them have closed all communal areas. They stopped all communal dining. All the meals are delivered to the residents. Admits to the facilities are being isolated for 2 weeks before they're moved into the general population. I mean, they have been very, very proactive in trying to protect their residents. They have had carried a lot of the burden of the deaths in our community. About 43% of the deaths in Mobile County have been from long-term care residents, but actually only about 15% of the cases in Mobile County are from residents of long-term care facilities. So I think there's a perception that they account for more of the positive cases than we have. So really the vast majority of cases in the county are community spread and not from long-term care facilities.
Can the health department release information about specific nursing homes and cases?
We cannot, and I think that has been asked multiple times. And so pursuant to Alabama Code Section 2211A2, notifiable diseases, any information gained during the investigation into an outbreak is confidential. So we cannot share that. The nursing homes or any facility may choose to share that information with the public, but we cannot share that information. And, you know, going back weeks ago, I stood here and said, you know, that there were outbreaks, but we cannot give out the specific information, the numbers, the specific facilities, because that's confidential information that's gained during outbreak investigation.
Could you tell us a little bit more about how the testing is set up at the Metro Jail, the purpose of it, and what is taking place over there?
Well, we had been talking to the Metro Jail for weeks, probably months now, just about the situation and advising them, similar to what we've done with the long-term care facilities, and worked with them also in getting the testing set up. But ultimately, it was decided that what worked best for them was for Director Barber to work with USA. So I think that either the mayor or Director Barber would probably be the best person to answer that question in terms of the specifics of the testing logistics. I don't know if that's, I'm not sure. But we help them, advise them in terms of, what to do about their, the population and segregating the, the infected. And we've been working with them all along, but in terms of the testing, they set that up themselves because they felt it was best to work with USA. So.
Mobile County Health Department. Mobile County Health Department was very quick to shut down restaurants when there was a possibility of spreading the virus. Why didn't the agency quickly close down long-term centers or nursing homes when COVID-19 was presented in this area?
Well, as I said before, we've been working with them throughout, throughout this for months and advising them in whatever capacity they asked us for to help them work with the situation in their individual facility. So, in terms of shutting them down, that, wasn't the necessary option to help them deal with the situation going on in their facility.
Was there ever any thought in isolating all the cases in one location to try to blunt the spread?
I'm not sure. Can you clarify that question? I mean, just in general, I guess I don't know that that's really an option. I mean, are you talking about long-term care facilities?
Yes.
Okay, so what we have recommended, again, is very specific to every facility. And when we talk to them, we work out with them, it is, again, very specific to each facility. It's down to how their facility is laid out, what sort of residents they have. Again, it's a very specific plan for their individual facility. But as you can imagine, their residents are pretty fragile. And so moving and transporting, especially in the early phases of this where we didn't have testing available, capacity available for every single resident, it just wasn't a practical thing to do. But also moving that many people who are in general fairly fragile was not a very realistic thing either.
If Crown and Linwood went public with their cases, why wasn't the Mobile County Health Department willing to name them earlier to protect the public?
I think that goes back to the code that says we can't do that. We can't violate that. It's confidential information.
Thank you.
Thank you.
Closing comments?
Yeah, thank you. Again, I would like to thank the community. This has been a hard period of time for everybody in the community, the families that have lost loved ones, those who are still trying to recover. It's challenging. Everybody in this room would love for COVID-19 to simply go away, and we could go back to life as normal. The interesting thing, 60% of the data, 60% plus of the data are 24 to 65 years of age of these particular known COVID-19 individuals. We're putting in place a method of tracking it, every single person closer as we re-engage in community activities. But most important, we must stress personal responsibility. And we've got to keep the numbers down. Number one, for yourself, for your friends, and for your family. Emphasizing again, if somebody needs to go to the grocery store, get their order and pick up their groceries. Don't put them in your car. Those who like to go golfing, rent 2 carts or walk, even better. The weather's gorgeous. But we really need people to take this seriously. It will be with us for months. And how we as a community engage in our own behavior will have a tremendous impact on the number of cases we have. I commend everybody who's worked hard, those who have suffered. I commend the mayor for the new program through the city council to help provide economic relief, and we will look forward to working with everybody as we move to the next phase of this illness and disease. Thank you.
Just a reminder that there is a drive-through testing site at the Walmart in Saraland. In order to access that site, you will need to go online to MyQuest, Q-U-E-S-T, COVID test, to arrange your interview. That is MyQuest COVID test, and that is at the Saraland Walmart. We want to thank you for all of those people who have requested signs and picked up signs, your Be a Hero, Stay at Home signs there throughout the community. And if you would like to have a sign, the locations are available on the Mobile County Facebook page. We have locations throughout the county where you can pick up a sign, or you can call 574-5077, 574-5077. Again, we thank you for the community's understanding as we have gone through this process. We're weighing lots of variables. We're weighing the economics of it. We're weighing how to save lives. And those are very difficult decisions to make. But I want you to know that we all are working together to achieve that, bring the best information, the best data to it, and a whole lot of prayers.
As we close today, I'd like to say that I'm very optimistic about things that I'm hearing having to do with progress being made on possibly having a vaccine, on the possibility of having the rapid serum test that FDA approved, the increase in the number of testing that tests that will be available. And so I think that is kind of been alluded to by the other comments. We know so much more today than we knew 6 weeks ago. We know that a lot of the models, because of their models, and based on the information they had at the time, thank goodness, did not prove to be true. And my hope is that as we continue to learn from what we've done, we will get better at doing the things that need to be done to protect you. So thank you very much.